All right, ladies and gentlemen, welcome back to Room1 podcast. I have Dr. Fred Schofield with me today. He'll be teaching here in Las Vegas April 20th, 21st at Room1. And he joined us for a podcast ahead of time just to give you an idea of what to expect and what to look forward to here in Las Vegas. So thanks for taking some time to do this with us.
Well, thank you, Ben.
Dr.
My pleasure.
Schofield, what is it that doctors are going to benefit most from coming to listen to you and the other speakers here in Las Vegas?
Well, they're going to learn a few things, that's for sure. The secret is to learn. See, first of all, T-E-L, truth. Now, truth is very complicated, but we know the truth. The tick. You were raised in a chiropractic family.
That's
correct?
True.
Your dad's a chiropractor.
He is.
He adjusted you from birth.
Absolutely.
You probably didn't need to go to a medical doctor ever.
Not until I became a pilot and have to have a physical.
Always. You've got to have a physical because they're the guardians of health. And look what they've done. Now, what they're going to learn is you've got to get a clear message in truth. That means your thoughts, your feelings, and your brainstem, the cortex, the limbic, emotions, feelings, and then the brainstem, the action reptilian brain. You got to get them all, and they got to have clarity. You're a pilot. Where are we going, Captain? Well, when you ask a chiropractor, most of them don't know where we're going. Well, in teleology, if you don't have the end in mind, don't take off.
Good point.
I mean, and if you're 1 degree off in Las Vegas and you're headed to Hawaii, you ain't getting to Hawaii.
You're going to miss it completely.
You're going to miss it completely. And chiropractic is Hawaii because it's small. We're not huge. Stop acting like you're the big. They got to stop. They got to tell themselves the truth. Listen, when my finger, the hook we call it, when my finger got kicked off in a rugby incident when I played professional rugby, I played after 3 surgeries with 33 stitches. Now, are they going to let you play today with 33 stitches? I doubt it. I doubt it. But we played because it was the cup final. We had to win that game. Now, that comes from something called courage. Now, courage is a funny word in chiropractic because courage comes from cuore, Latin. Cuore means your heart. But cuore also means confidence. And when you leave Las Vegas, you're going to have clinical confidence. And that's the biggest thing lacking in chiropractic. First, no vision. And as you know, where there is no vision, the people perish. Or self-sabotage. Self-sabotage. I've trained thousands of chiropractors, 25,000 chiropractors. Half of our profession have been to our training. You know what I find? Self-sabotage. I've seen the most successful blow it. I've also seen guys who struggle because they didn't have the right destination. They didn't get clarity. When I coach people, I'm talking to you, and we're talking about, well, I don't have affirmations. Now, affirmations is just what goes through the reticular activating system. So, and which is the filtering system of your mind. So if you say fire hydrant, I say, well, how many did you see? Did you go shopping today? Yeah. How many fire hydrants did you see? None. We did this experiment in our office at a staff meeting. They left, and I said, count how many you see on the way home. 61. on the way home, 0 coming. That's called consciousness. That's called I'm awake. That's called mindfulness. That's called being in the moment. That's how innate contacts you. By you asking, programming, conditioning what you want. Then most people don't know what they want. When we got married, we had 60-year goals. I'm on 37. I just practiced this morning. We saw close to 100 patients. No big deal. Anybody can do it if you're organized. Most chiropractors, for instance, don't have enough equipment. They got one table. You're not going to see 100 in the morning in one table. We, on the other hand, have 7 tables. So we can have 7 people. We're like the Uber of chiropractic. And we're just taking over. We are so busy, Ben, it's ridiculous. And our clients, our biggest client had 30 new patients last week, all referrals. Come on now. What's he doing that the rest are not doing? That's what they're going to learn. They're going to learn, get a clarity of a compelling vision of what you want. Get some clinical certainty and get some confidence. And then, let's go to work. I'm an immigrant, Ben. I arrived in this country with $40. True story. I worked for $200 a month. I got paid $2.58 an hour. And if I can do it, Ben, anybody can do it. But they got to be driven. There's that intangible, that emotional intangible. My father was a medical doctor. I didn't go to a chump government school. I went to the number 1 school in South Africa. Ranked. They rank the schools. And it's not just on one subject. It's everything. And it's interesting that our school was founded the same year that chiropractic was founded, 1895.
Wow.
And
okay.
we have the same Latin, altius et latius. Higher, vertical, above down is the vertical axis, and the horizontal, inside out. Above down, inside out, or altius et latius, higher, altus. But if you want to go up, Ben, you know what you got to do? You got to be grounded.
You
That's
don't
what a
build
lot of people
skyscrapers
forget.
without a foundation.
Come on, baby. Come on. And chiropractic is weak. First of all, I think it was, who said, give me a lever long enough and I'll change the word. Archimedes, I think he said. And one of those cats. But he said, get some firm ground. Stand on firm ground, which means get your philosophy, get your principles, like what your dad teaches and you guys teach. Get your principles. Most chiropractors are slaves to the insurance companies. Slaves. Mm-hmm. They're not out of debt. They don't own anything. We've been out of debt since 1987. So I can tell the truth when I'm out of debt, you see. Yes. When you're dependent and you got, free. I love all these. Of course it does. And all these guys who show off on Facebook and look at me, I'm driving a Ferrari, a Lamborghini. Look, they got no money. Mm-hmm. You got a family of 5. Are you driving a Lamborghini? No, you're not. It's not a family car. You're driving a Suburban. Get a life.
So let me ask you this, Dr. Schofield, and I sort of heard it all embedded in what you just said that the doctors are going to discover in Las Vegas. But what do you see chiropractors needing to do most in order to become the authorities of the future of healthcare in the eyes of the public?
Correct. Find what first of all, it's complicated, Ben. It's not just a one size fits all. It's not a day 1, day 2. I got a day 1, day 2. But what about day 3? What about day 87? When you got somebody who's 90 years old in Antalya. I mean, I coach clients all over the world, and the biggest question is they always call me. I just got a text coming here, and I don't drive and text. I just pull off the side. I live in a little farming community, and he goes, the patient has radiculopathy at L5. What do I do? Straight out of school. Now, don't you think radiculopathy, low back, don't you think that would be a go-to for chiropractors? Well, the funny thing is, lumbar rolls are out. The research says high impact adjusting, stop it. It's not as effective as low force. Wow. You mean I asked a patient this morning, you want me to take a baseball back to your sacroiliac joint? He goes, no, I prefer that nice little, you put me on these lumbar sacral traction. See, that all comes down to how you want to fulfill your vision. See? That all comes down. How do you want to be adjusted? Mm-hmm. And you got to get one thing straight. Are you in the service game or the money game? And don't tell me they're the same. You have to cover money up front. It's the number one blockage in your practice. Money.
I would agree. Yeah, I could see that. Absolutely.
America is based on money. Freedom. You don't have a king who can just come and take your wife away and steal your children. You don't have the czar stealing children and raping and all the. We don't have that today. It's ridiculous how free we are, and yet chiropractic stands for freedom. Mm-hmm. You have a choice.
It does.
Freedom is a choice. And my patients are given a choice. You can carry on doing what you're doing. This guy's 300 pounds. He's just retired. I said, he says, yeah, I go to a chiropractor once in a while. I said, did the chiropractor tell you just maybe you're a little bit overweight? No, he didn't say anything. Well, you are. Yeah, I know that. I said, but you're not overweight. Well, what do you mean? I said, you're in a state of inflammation. And if we take the inflammation away, the body will take care of itself. So all I got him to do is drink a carrot juice in the morning and don't eat until 11. Intermittent fasting. That's all he had to do. And cut out the carbs. But he can have them on Saturday and Sunday. 5 and 2. You know, God went 6 and 1, and you ain't God. So we're going 5 and 2.
Okay.
Okay. My wife invented that because raising children is 5 and 2. Spend some time at home, I tell our clients. Kind of enjoy your home life. Have all the money and no home life, you lose.
I agree. Yeah.
And I see all these guys teaching on the weekend. I often wonder, where are their children? I wonder, I'm going to see how they turn out. It's going to be very fascinating. Because I'm a practicing chiropractor. I love chiropractic, Ben. This is my life. I have 2 children. I have 3 children, but 2 of them are chiropractors. Very successful. They should be speaking, actually, because they talk to the younger crowd better than I do, because I just am a little bit confrontational in that you're not going to take me off my perch. See, I know the science works because I have a thing called Bertolotti syndrome, which means I have a low back distortion in my low back. Most doctors will know what that is. And my dad was a medical doctor, and he said, it's all in your head. And I said, no, Dad, it's not. It's right here in my L5 on my left side. And he goes, you know, when did you go to med school? I said, I'm not going to med school, Dad. That's off the chart. I'm not going. Okay? Get it. Get used to it. Because he wanted me to be a doctor so bad. Except I became a chiropractic doctor. I'm a doctor of chiropractic. And super proud of that. Super proud. The hard thing I find in the young doctors is they won't touch me. They will not touch me. I won't allow them to touch me. Because there is a thing called a skill. And you have to do some inventory. This is tough stuff. You have to learn. I learned philosophy when I studied at Notre Dame. I didn't go to school at Notre Dame. I just found out what they teach in philosophy. You don't have to go to school. You don't have to go to school. You got a bloody internet. The hell are you doing? What are these students doing? $300,000 in debt, and they can't adjust when they leave. What did you do with the money?
Yeah.
So the first thing I did when I got into chiropractic, I said, is there any money in this game? See, what your dad and you guys are on the mission is to make chiropractors more successful, and a lot of them are not. A lot of them are not. You ask, they got massive overhead, and it's just not, they're just living for one day of profit. See, ours is to cover our profit in the first 5 days of the week, and then the rest is gravy for us. So we try and hit our overhead as fast as possible. And if you can't, if you're waiting for day 29 to make a profit, you got something wrong. You're not going to tell those patients the truth. I can guarantee you that. I've been in practice 37 years. You're not going to tell the truth. Come on in, I'll fix you. That's a lie. That is a flat out lie. I take my dog to the vet. He fixes my dog. That's the truth.
That's right. Good. So I want to let everybody know that's listening how they can get tickets. You got to go to room1lasvegas.com, and when you get the tickets now, you save $50, which means your CE will be free when you pay for it at the event. You can get up to 15 hours of CE in most states. And what I want to do in closing with you, Dr. Schofield, is I would like to ask you what you would say to people that have seen the lineup of speakers. They probably want to come hear you speak. They probably want to come hear the other people speak. But they're on the fence about whether they should make the money investment or the time investment to get here. What would you tell those people?
Stop thinking and do it.
Stop thinking and do it.
When you're in a state of abundance, you'll get those new patients. The excitement of you going will generate new patients. When you're excited, like I just finished a ski vacation that I teach a class up in the ski hills of Montana, and they were so excited. It was palpable, the excitement of those doctors, that some of them saw 10 new patients in a day, just before they came. And the same thing, we're going to the Cayman Islands next week, and the same thing's happening again. They're getting so excited that, boom, here are the new patients.
And we may not understand how that works, but we know it does work.
Oh, we do know how it works. It works on physiology, not psychology. But we'll get into that another time.
Wonderful. All right, for those of you listening, you got to go to room1lasvegas.com to get your tickets. Remember, you save when you get them early. It's room1lasvegas.com. You can hear Dr. Fred Schofield speak here in Las Vegas April 20th and 21st, as well as a whole host of other people, which are also listed on the website, room1lasvegas.com. Dr. Schofield, it was a pleasure having you here today, and we can't wait for April in Las Vegas.
Right on. For those that are sitting on the fence, sign up and do it now.
All right. Thanks for your time. See you soon.